Let's talk about what the Botox can be used for. So when people complain about lines, the first thing to notice is that if you are completely resting your face, then the forehead is nice and smooth, as is this area here.
Okay.
When you now raise your eyebrows, we start seeing the lines forming.
Yeah.
Or if you relax there and frown like you're angry, you can just start seeing the beginning of the lines there. So if we now zoom in a little bit there, and you can see that at rest, there's one little line just there.
Yeah, that one.
So what we want to really do is, Botox is designed to treat these kind of lines that appear, raise for me again, when you make a movement.
Yeah.
So lines that appear on animation or making expressions, they're ideal to be treated with the Botox.
Okay.
Once the lines have formed and they're there, even whether you're making a movement or not, they may improve with Botox treatment, but it takes a longer to see that impact.
Brilliant. Right, and then you often treat these ones around here, because I've got a whole bunch of those that scrunch up, and then lower face is where I find it's interesting, because everybody thinks Botox is, it is classically just for the upper face, but in the lower face, anyway, we'll see where we go with that.
Yeah, well, let me give you an example.
Yeah.
So, for instance, if you look into your camera and then just down turn the corners of the mouth. So when you do that, you notice that you really sort of drop the corners of the mouth, and it kind of gives you a sad expression. And that's due to a couple of little muscles we have down here, and also we can sometimes get some dimpling of the chin.
So when kind of cobblestoning.
Cobblestoning, yeah. So treating in the lower face is definitely more advanced. Not maybe all the practitioners will do it, but the thing to understand is that the face is just all about balance. So we have muscles in the upper, mid, and lower part of the face, and treating them in a sort of harmonious way, that's what gives us the most natural result.
Fab. Thank you. Okay, right. So now I'm on the couch. I'm all agreed. I've given consent, and we're ready to go.
Yeah. So what we always do is we begin just with cleaning up the face.
Yeah.
The thing about these type of procedures is they are very easy to administer, but they remain medical. And there are just a couple of little caveats that we have to bear in mind. One, it is a needle that goes through the skin, so we have to ensure that everything is done in a nice sort of sterile manner. The second thing is, anytime we put a needle through the skin, there is always the risk of a little bit of bruising. So this is probably the two commonest, the bruising is probably the commonest side effect from a Botox treatment, but it very rarely happens, and if it does, it tends to be a very small little bruise that could easily be covered up with a little bit of makeup.
Because the needle is super fine. Super
fine, that's the thing. Some people worry that it's going to be painful, but the reality is that it's very well tolerated.
Okay, so now
the next thing we're going to do is mark you out, because everybody is different. Our faces are different. The muscle balance is different. So I can't treat you and the next three people who come in the same way.
Yeah,
and that's another important
thing. That's crucial, isn't it? Yeah, because some practitioners will just have a sort of map of what they Botox.
Yeah.
And,
That's like one size fits all. And in fact, to borrow your word, we have to tweak it for each patient. So let me just get you to frown again like you're angry. So as you quite rightly identified, you don't have much movement sort of between the brows, so just relax for me. But we're still just going to add a little bit of treatment here. And what's important is sometimes people say, that's not where my line is. But we're not treating the lines, we're treating the muscles responsible for creating the lines.
Yes,
so
of course.
When we place the dots can be a little bit confusing. So raise for me high, and that's great. Relax for me. Now, big smile for me, and relax again.
And Botox is a branded form of botulinum toxin, isn't it? Which I think most people know.
Yeah, it's probably the most well-known and popular brand. It's been around in some shape or form for more than 35, 40 years.
Yeah.
And in fact, Sam, just give me 30. Brilliant. And what's important to understand is that it has medical applications as well. There's more than
this
50.
Is Sam, so I've just waved.
There's more than
Phi aesthetic nurses, I'll take.
Absolutely. There's a lot of medical applications for it as well.
Sure,
so it's
for muscle spasticity and...
so many, each year probably we find a new application. We use it to stop sweating. We use it for people who have tight internal stomach muscles that causes reflux. We use it for certain painful conditions. So let's go ahead and just start injecting you. So I'm just going to get you to relax. Close your eyes and a little pinch here.
And there's no anaesthetic because it really is not needed. I mean, you don't need ice for these injections, do you?
No, I think what's really changed in the time we've been doing them is that the needles, the syringes, and all the various bits and bobs that we use have adapted so well, so that when we do these treatments, I think we genuinely now find that people are often surprised at how comfortable the treatment is.
Yeah.
And I think, there's a lot of things that we do to ourselves, especially a lot of our female patients do, in terms of things like waxing
ripping
or whatever.
Hair out. That's always...
Things like that could be a lot more uncomfortable. Okay, here, don't scratch.
And so these are the muscles that raise the forehead.
Correct.
Yeah. And what Botox is doing is inhibiting the ability of the nerve that's telling the muscle to work.
Perfectly put, yeah.
To get through, it blocks the receptor, doesn't it?
That's exactly what it's doing, yeah.
And then, does the receptor in time regrow or readapt itself?
There are new connections made from the nerve to the muscle.
Okay.
So that's why it explains that, a Botox treatment is not permanent. It will last, typically in most patients, somewhere between 2 and 3 months.
But that's the extraordinary thing about it, isn't it? Because people think, first, it freezes the face, which it doesn't. It's damping down that response, isn't it, depending on how much of a dose you give. And then, because the muscle adapts, it simply can do what it did before. And
I'm just going to turn you this, I'm going to start doing the lower face.
People often say they're anxious about having the laughter lines done because it will take away their smile. But I find, well, maybe it's because I've got so many of these, that you can really put quite a bit of Botox in these, and I seem to be able to smile just fine.
I think that's a really good point, that we smile with our eyes and we smile with our mouth. And often if this area is over-treated, as it can be, I think you're right, it can lead to a slightly strange expression where the mouth is smiling but the eyes are not. So that's why it's, again, quite important to tweak the treatment to, the individual face. And what we often do with, first-time patients, especially somebody who's a bit nervous, is we'll probably undertreat, because the great thing about Botox treatments is that you can top up, you can add in afterwards. So, nobody has a set dose, everybody's different. Yeah. But the important thing is that, if I was seeing you for the first time, I would put in a certain amount, I'd review you in a couple of weeks, and then I'd bring you back. If you were happy, we'd leave things as they were. If you said, I like it, but I want a bit more, we can add in.
Yes, now that review, that was something I wanted to say. I always book in for a review. I mean, even though I've been coming to see you for years, because things can end up not looking exactly how you might like them, even though most people will say, it looks fine. But if something happens, because I posted a picture the other week of treatment from some way back, done by somebody else, where my face looked really very strange. And I've had a lot of comment back about that, saying, well, I had to go back to the practitioner and have it adjusted, but you should always have a review booked in, shouldn't you, just so that you can have that.
I mean, because things do happen, sometimes we can get slightly asymmetrical results.
Yes.
What's not uncommon, and I think people have seen this, is that sometimes we over-treat the middle part of the forehead here, which means that the muscle's still working here, and people end up with this kind of quite suspicious-looking brow, and people say, I don't want that Spock brow or that,
yes, the Joker brow. Yeah, that is my pet hate with Botox. I see it a lot with colleagues. They have this bit completely pinned down because of that over-treatment there.
And then that sort of happens. But if that happens, it's very easy to fix. So what's important to understand is that sometimes these things happen, but they have a remedy. So a practitioner usually will treat in such a way that were something to happen that you didn't like, we can fix it. The worst thing that can happen is somebody puts too much in, because then there's nothing you can do about it. It will
But it
wear
will
off,
go in time, won't it? That is pretty well the worst, apart from a tiny bit of bruising or whatever. But I mean, this is minutes after. You can see that it's almost invisible. There's just those few tiny spots. So
they look a little bit like you've just been bitten by a mosquito or something, but that will go in about 5 minutes. And then by the time you walk out, nobody would be aware that you've had any treatment. So
it can be a lunchtime, any time. We're middle of the morning here, aren't we? I've got a meeting coming up, but then people are used to me turning up.
I'm sure they are.
Tapan, thank you so much.
It's a pleasure.